what is the importance of research-driven, like leaps and bounds in this sort of a field? What is the importance of the creation of a holistic system? How does one reach to that level?
Well, thank you for giving me a chance to say a little bit more to you. And I just want to say I really appreciated Dr. Kavita's explanation. I thought that was so lovely and articulate and well put about the influences on children and development and their understanding of gender and the confusion. And, that's an area, for example, where we need a lot of research is on the development of gender identity. Most of the research has been done on the development of cisgender identity. And cisgender, for those, many of you probably know, but I'll just say for those who may not know, cisgender means that a person's gender identity that they experience, that they own, matches the legal marker that was assigned to them without their consent. And the majority of the population is cisgender. However, we need more research on understanding identity development on youth who are transgender or who are gender diverse, gender expansive, gender creative. And additionally, we need research understanding the adolescent experience as well as the adult experience. In terms of prevalence, the research indicates, at least in Western studies, that about 1% of youth are identifying as transgender, and about 2% are identifying as non-binary or questioning their gender identity in one form or another. Non-binary may not be as familiar a term. I don't know. I understand that there's a lot of development about different gender identities going on in India at this time. But if you think about 1% of the population of India, that's over 13 million people. That's a lot of people who are needing sensitive, informed healthcare around their gender identity, and then double that many who are non-binary gender questioning. Now, I will tell you that's from Western studies. However, WPATH faculty, we've done programs in other countries. I did one in Vietnam where I was training folks just before the pandemic in 2020. And we were finding similar statistics in Vietnam. So it's very important that we understand, first of all, the prevalence, and then the pathways of development, and then what interventions are going to be the most helpful. Because some people benefit tremendously just from hormones. Some people benefit the most from a social transition, meaning they're going to change their name, their haircut, perhaps, or their clothing, their presentation. Some people need surgeries. And then how do we get the best outcomes from those different interventions? So there's a lot of areas of research that we're needing. And again, I would say we want this to be research that is done, nothing about us without us. In fact, in the International Journal of Transgender Health, which is the publication officially of WPATH, that is a policy to try to have a trans or gender diverse person on every research paper that is accepted. I guess I would also like to add, as I may not get the opportunity to say a lot more, I know we're going to be moving on some, but as a transgender man, I really appreciate the education that is going on here. I was raised a girl, and much like Dr. Kavita described, I kind of was like, oh, well, I guess everybody's telling me I'm a girl, so I'm supposed to do these things, but none of those things fit for me. And I just happen to be a more typical binary guy, but because of all those social, cultural, community things, it took me such a long time to discover it. I was in my 40s when I realized that I was transgender. And I thought I was just a lesbian. And I point that out just because a lot of families bring their kids to me thinking, can my kid just be gay? And I help them understand that being gay is very different. You know, I was in the lesbian community, but that didn't fit either exactly for me. And so I transitioned about a decade ago in my late 40s. And it's been a real privilege to be able to provide education, but also to be participating in research to help us understand how do we help people get in touch with their gender identities sooner. So this is a social change that we're talking about. And as physicians, future physicians, as mental health professionals, you are going to be leaders and thought leaders in your country who can shift the tide of thinking and destigmatize and depathologize gender identity. And so I applaud the leadership of our young folks, of the medical students, and I really praise the faculty and the IAP for listening to the leadership of the young people in bringing gender issues much more to the forefront. So